I'm Dr. Lubanga Dickens, a pediatrician at Bungoma County Referral Hospital and Bungoma Children's Hospital. Today we discuss on food poisoning, which is an important part, especially for children. Uh, Food poisoning is important because this can kill a child who has been poisoned by the food they consume, or actually water that is used to cook the food. Then they stand at a high risk of dying because of extreme vomiting and because of extreme diarrhea, which causes dehydration that tends to affect them. Remember, majority of children, between 70 to 80% of their body is composed of water as compared to adults. So whenever they lose a significant amount of fluids in the body, then they're exposed to having other complications like going into shock. And shock is the single most complication of diarrhea and vomiting, and that leads to a lot of these deaths. So food poisoning, I know people might just think is maybe a poison or somebody putting something in the food or in drinking water. Yes, that can also be part of the definition. But here we are really emphasizing on other causes of food poisoning. Food poisoning can be caused by bacteria, can be caused by viruses, can be caused by parasites. And so all these are in our environment, and they're actually with us. So in terms of bacteria, there are those ones that most people know. For example, typhoid, which is a common cause of bacteria that causes diarrhea. But this one also, it can also tend to cause bloody diarrhea in children specifically. There's also E. coli. So E. coli is also a very bad bacteria, and this one can also cause bloody diarrhea also in cases where it occurs. The others that are caused by other agents like cholera, which is quite problematic, especially in places whereby the children are consuming water that is not sanitized or that is not clean enough. And so those are examples. But in children, most of the time, we tend to have more of the viral causes, including rotavirus, which used to cause a lot of mortality, especially for children. Remember, rotavirus, in terms of its pathogenesis, it starts with vomiting, then you go to diarrhea, and then from there you go to high-grade fevers. And these ones, they tend to stay for long. It can even stay for 8 days actually in the body. And unfortunately, most of our population here, most of our doctors do not know how to test for rotavirus infection. Most of the time, I've even found cases that are treated for malaria because they'll present with signs and symptoms close to malaria. They'll have high-grade fevers, they're going to have vomiting, and they're going to have diarrhea. But usually they don't have malaria. So usually the main thing is the rotavirus that actually tends to affect, causing some kind of colitis. Colitis just means that there's inflammation within the stomach walls or the intestine walls. And so this causes a lot of irritation. And so this tends to give us very complicated symptoms. So in terms of clinical presentation, how will these children present when they have food poisoning? So the most notable thing you're going to see, usually most of the time, once they get these infections, the symptoms might start as early as 6 to 8 hours after ingesting the food that is contaminated or water that is contaminated. And the majority of them will start with vomiting, and then from vomiting, most of them will also go towards having diarrhea. The diarrhea can be bloody or mucoid. And so if it is bloody, of course, most of the parents will tend to seek help faster. But the ones that we find which is not blood-stained, most of them will tend to ignore. In fact, they might just go over the counter and self-medicate with medicines like Flagyl, which are common over-the-counter medicines. And remember, these ones, you are giving somebody drugs, but you don't know what exactly they're suffering from. And that's why we normally try to ask the patients to go to the nearest hospital so that at least it's measured and it's analyzed in the laboratory and we're able to know which kind of infection or exactly that you are dealing with. Because again, for the antibiotics, we have different antibiotics for different diseases. You see now a disease like cholera, the kind of antibiotic that can be used for cholera is not the same that can be used for rotavirus diarrhea. In fact, rotavirus diarrhea, we don't use any antibiotics. And so you see, because of that, we normally encourage our parents or basically the guardians of these children to promptly take them to the nearby facility for proper evaluation. So majority of the time, again, either you might see decreased urination. So decreased urination is because you see the child is losing too much fluids because of vomiting and diarrhea. And so they don't have, so the kidneys start getting affected. And so remember, there's a certain volume of fluid that must go through the kidneys at any particular time for the kidneys to be effective. Otherwise, when the kidney sense that there's little fluid that is circulating within the body, then they shut down. And so most of these children who are having diarrhea and vomiting might actually develop kidney disease, so which is a complication again. So some even might have actually convulsions, because extreme diarrhea will tend to lose a lot of electrolytes. You're going to lose your sodium, you're going to lose your potassium, you're going to have very low levels of potassium. And so you're going to have low levels of magnesium, and this one can also predispose you to getting even the convulsions. And also some of them will present with high-grade fever, like rotavirus diarrhea. And so this one can also give you convulsions, because high-grade fevers tend to be a major cause of pediatric convulsions. Another thing that can also suffer, usually these children will present with tummy pain or abdominal pain. They'll want to, you'll see them disturbed trying to sleep on their tummy. So it causes some kind of discomfort that and that's why we encourage our parents, when they see this, it's better to bring this child early to the hospital. So in terms of treatment, so most of the time after we have analyzed, we have done our laboratory studies. Usually if it is, if the major cause, for example, is a cyst, so a cyst can be cyst like entamoeba, that is amoeba. Now, so if we isolate amoeba in stool, then we are going to give the antibiotics that are able to deal with the amoeba. And now the most common that we give is Flagyl. Now, if the cause is typhoid, so there are also antibiotics that we use. That's after doing the test. And remember, currently, the current test that we use is stool test. Previously, we used to use blood test. But that is no longer recommended. Now we use tools that we're able to get to isolate the real salmonella that is giving us this typhoid. Now, for drugs like, for diseases like rotavirus, especially those that occur in very small children, so usually the majority of the management is supportive. So supportive means that you replace fluids that the child is losing through diarrhea and vomiting. You also replace electrolytes. And also, by doing this, also we tend to avoid kidney failure, which is the commonest cause of deaths. Now, for those ones that have bloody diarrhea, sometimes for those ones who are close to 7 months, usually the most common culprit is actually intussusception. So intussusception, you are saying that sometimes during the course of digestion, intestines can be trapped into each other. And when these intestines are trapped into each other, especially for those small babies, then they tend to have an obstruction, and this obstruction now tend to cause frank blood in the stool. And most of our doctors, when they see bloody diarrhea, they just think is the bacterial and the viral components or parasites that are causing this. But remember also, some of them might actually require surgical intervention, so that we operate them to ensure that interception is opened up, so that they can be able to continue passing the stool well. But remember also, it will also present as diarrhea initially before it starts having issues of. It will start with the diarrhea, it starts with vomiting, just the same way like any other food poisoning can also present. And so most people will actually start managing these children for food poisoning, when ideally they do not have that food poisoning in them. So if it's a fungal cause that is causing that, because sometimes, for example, in people who are HIV compromised, they tend to get some fungal infections that can cause diarrhea. So usually we put them on antifungal medications, so that they're able to be to respond. So majority of viral diarrheas, we treat them as symptomatic. So we give fluids. For children, we give them ORS, which is the oral rehydration salt. We also tend to give zinc. So zinc tends to help the epithelium of the intestinal lining, so that it's not destroyed. So zinc is a very, very useful component as part of their drugs. And also in children, also that those ones that since they tend to shed their stomach lining or the intestinal lining, we tend to give them probiotics. Probiotics help in terms of repopulating the good bacteria which is available in our intestines, to help us also, because these bacteria sometimes they help in absorption of food and also food breakdown of some of the waste matters that are in food actually. So we have to replenish that for their correct, to improve their digestion and also to reduce this diarrhea also as it is happening. So in terms of prevention, so how do we prevent this food poisoning? So you have said, and this starts from very small babies. So for small babies, we say that usually the ones who are below 6 months, whereby the ministry has encouraged exclusive breastfeeding. Remember, exclusive breastfeeding, breast milk has enough water. 80 to 90% of breast milk is actually water. And that's why we tell mothers not to give any other external source of water to these small babies. So the only food they should take is breast milk. Because you see, again, depending on where we come from, because of our socioeconomic status, again, sometimes, because you see, hand washing becomes problematic. And so you see now these young children, if their utensils are not cleaned appropriately with very hot water, they might actually they're at risk of getting infections from these utensils. That's why we say the mother's milk is the best, and also it helps us to give them immunity for these children, so that they do not tend to get other infections. Now, number two, in terms of prevention, we are talking about hand washing. We said that before anybody is handling food, let us wash our hands. And for effective hand washing, you should wash your hands for at least 20 seconds with soap and running water. That way you are sure that you might not, at least you are able to clean your hands very well to avoid this bacteria or viruses. Or if you have alcohol, then you can actually sanitize with 70% alcohol your hands, so that you do not tend to get these infections. Now, and you are saying that also, so in terms of hand washing, that's also what we should tell our children, that before handling any food, children are picky. They see their neighbor's child has got maybe a banana or something, so they want to pick at the same time. So we normally ask that, if possible, that we tell them about hand washing, because when you educate them at a very young age about hand washing, then they'll be able to wash their hands before consuming food. And that way, that is the only thing that is going to assist us in terms of preventing this. Then access to clean water. So and this is a public health intervention, because now to ensure that all the water that is, whether that's provided by the county government or by the government, at least is treated. And we have very simple ways of treating this water. You see, by just using chlorine, basically you have killed the majority of the bacteria and you help that water to be not contaminated by just filtering water to exclude some level of pathogens within the water, and then basically we are helping ourselves. Not cooking food well, because you know that some foods, especially eggs, things like pork, they tend to have a lot of bacteria, and red meat. So we ask at least you should cook it at least 100 degrees Celsius, at least for 20 to 30 minutes before, even if you are going to fry it, before frying it later, because most people tend to fry it within 5 minutes or 10 minutes, and they serve it. So when they serve it, it means that majority of the pathogens are not actually killed with that short period of cooking. They're also saying that also, so interventions like vaccination. So now viral infections like rotavirus, the ministry gives free vaccine for younger children. But if we are able to recognize these things earlier, then basically we'll tend to reduce the progress and also reduce the number of deaths that are associated with this diarrhea. Yes.